A firm appeal and assurance that ethical processes are in place to monitor the impact of COVID-19 vaccines.
Stop spreading misinformation. There are protocols in place, and I know they are being followed. It's not to say that because it happened after vaccination, it was caused by vaccination.
Professor Meyer's appeal to the public comes after confirmation that the 29 deaths probed after the deceased had their COVID-19 jabs were not caused by COVID-19 vaccines. She says these deaths after vaccination were coincidental.
26 of them were found to be coincidental to the vaccination. So it means they are not linked to the vaccine at all. 3 cases are unfortunately unclassifiable.
We have vaccinated in South Africa over 8 million people at this point in time. However, we have about 2,000 adverse events that I've alluded to. So that indicates the fact that vaccines are safe.
The Health Department is confident that its probe was credible and that no COVID-19 vaccine deaths are being covered up.
We have no reason to hide any deaths. When we have information and when it's been thoroughly investigated, if there is a causal link and a vaccine has caused the death, which we know is possible, then that will be reported as such.
COVID-19 vaccines have been administered worldwide for over 8 months now. Billions of jabs have been given, but for anti-vaxxers, this is not convincing.
Because we're not sure of the complications of this vaccination, I think it shouldn't be forced.
SAPRA has confirmed that it was investigating more suspected cases of COVID-19 related deaths linked to the Johnson & Johnson and Pfizer jabs being administered in South Africa currently.
We do have more cases that are currently under investigation, but unfortunately I don't have the numbers at hand, but we do have received more cases that are under investigation.
Prof Meyer and SAPRA has urged the public to report all side effects after taking their COVID-19 vaccines, even the minor ones. This will help with adequate monitoring. People can report their side effects to their nearest health facilities or on government's COVID-19 related apps. Patricia Fasaki, SABC News in Pretoria.